name is Joe Wilson. I'm an orthopedic surgeon at Emerge Orthopedics, and I specialize in shoulder surgery. Most common symptoms that we see with shoulder injuries, many times people end up having pain with overhead activities when they're reaching for objects, even such simple things as taking on and off a shirt, many times putting a bra on, lifting things out of the refrigerator. Those are kind of activities of daily living. Many people end up having pain and discomfort with this. Sometimes it's a very sharp and debilitating pain that they feel only when they're lifting objects. Many times it's a dull ache that they feel throughout the day. Many times this is a symptom of some underlying structural problems in the shoulder or some significant inflammation in the shoulder from an injury. Many common treatments that we start when it comes with the shoulder injury are things that people can start at home. Usually we recommend some period of rest, especially if it hurts when you're doing some athletic activity or working out. We always recommend starting with some anti-inflammatories, Motrin, Aleve, Advil for a period of time. Sometimes ice can also be very helpful in the acute phase right after you injure the shoulder. Those are usually activities that people do before they come to see someone like myself who's a shoulder specialist. I think if you have a shoulder injury, back in the day, everyone would go to their kind of primary care doctor to start the treatment. That's really changed significantly now, where most people can come directly to the specialist. It not only saves you time, but saves you money, because most of the time our primary care doctor is just going to refer you to someone like myself who is a shoulder specialist. So people can self-refer now, come see us directly so we can give them the best possible treatment in the shortest amount of time. So if you're at home, it's been a week, it's been 2 weeks, and you've tried rest and ice and elevation and anti-inflammatories and you're still having just as much pain, that's when you recommend you come see someone like myself who's a shoulder specialist. At that point, we always end up getting x-rays. We want to get x-rays to make sure you didn't cause any there's no significant bony issues with the shoulder. Most of the time in my younger patients, we do not see that. Sometimes in my older patients, we're looking for any signs of early arthritis. If it was a traumatic fall, obviously we're looking for a fracture or some other abnormality to the shoulder. Many times the x-rays will be normal. The next thing we usually think about instituting is if it's a significant injury where they have very limited use of the arm, we'll go right to getting an MRI, because that allows us to see the rotator cuff and the bicep and the labrum in the shoulder. If it's not as much of a significant injury, many times we start with a corticosteroid injection. If the corticosteroid injection works and it's purely inflammation in the shoulder, many times that can be a quick and easy solution to someone having shoulder pain. The question I get frequently is, when should I immediately come in to see a doctor? Or specifically a shoulder specialist like myself. Those are mainly things that are more traumatic in nature, meaning you have a traumatic fall to the point where you can't raise your arm, you dislocate your shoulder and you have to have it relocated by the emergency room. Things that are more higher velocity in nature are things that you come to use. If you're 20, 40, 60 years old and you fall and you can't lift your arm, due to the amount of pain you're in, that's something we want to get evaluated fairly quickly. It's not uncommon that I see 30 and 40-year-olds that fall, they can barely lift their arm, and they come in and we end up getting x-rays and we can see small non-displaced fractures of the greater tuberosity to the shoulder. And those are things we want to know sooner than later, so you don't cause more damage by using it as a